On the coronavirus front, nearly 3.1 million Americans now have the virus as positive case counts continue to climb. As I mentioned earlier, Alabama saw their case count spike by over 2,200. So for more on this, I want to bring in Dr. Cedric Dark. He's assistant professor at Baylor College of Medicine and board member with Doctors for America. Doctor, thank you so much for joining us today.
Thank you very much for having me on.
So each day, it just seems like we are smashing these new daily records, which is, of course, a negative. As we're seeing these case counts start to rise, how long do you think we're going to see this curve essentially spike? It was at a point where we thought everything was starting to flatten, things were starting to decrease. Now you just look at the trends, everything's on its way up.
Yeah, we've seen, 3 million cases now in the United States. I'm in Texas practicing in Houston. And here we have 10,000 cases daily, which is the highest that we've ever seen. Yesterday was the single deadliest day for the pandemic here in Texas. And it's only going to get worse. We did have it under control, as you said, a couple months ago after our local officials in Houston implemented a stay-at-home order, implemented a mask order. And the problem is our governor went out and preempted all of that. And people stopped doing what they needed to do. We weren't allowed to enforce that. And our case counts, which had been fairly steady, have been rising heavily ever since.
So to that point, how concerned are you that government officials from the White House, even down to, governors and perhaps local mayors and politicians, frankly, are not making the right calls here when it comes to handling coronavirus?
I mean, it's an extraordinary concern of mine and to many of my colleagues that we have an abject failure from our leadership from the top all the way down to the states. The only people that I can trust that are doing the right thing for me are local officials, and the local officials here have been doing just that. If you happen to notice yesterday, the mayor and the city of Houston actually canceled the GOP convention that was going to be held in Houston in a set of upcoming weeks because of concerns like your previous guest was mentioning from the workers that would have been at the George R. Brown Convention Center hosting the conference. We had to shut that down because, as we know, having all these huge numbers of people indoors congregating is just a super spreader event waiting to happen.
So do you think, are we spiraling out of control right now, or is that upcoming? I feel like we keep asking, are we in the middle of a second wave? Is a second wave coming? Where do you think we stand?
And I think right now it's too early to actually say what's going to happen. Our governor did go back on to what he had done in the first place. He reissued a statewide mask order for Texas, which I have to applaud and say thank you for finally doing the right thing, Governor Abbott. However, the question remains, what will happen in the weeks to come? It's too early to see the change. We still have increasing case counts. Fortunately, our fatalities had been about the same, but I've started to notice on our government trackers that we are seeing fatalities increase in Texas. And the question is, will the masking order that went into effect last week actually be enough, or do we need to continue to dial the economy back down? He closed the bars, but we probably still need to dial back down our reopening to what was called phase one, where restaurants were only open at 25% capacity, because if people are still going out to eat indoors at restaurants in a very large numbers, we're going to see this continue. Ultimately, this is going to be determined by the people of the United States and the people of the state of Texas. What we decide to do for ourselves is what's going to determine how coronavirus evolves. Are we going to stay at home when we can? Are we going to wear masks when we can? Are we going to actually care about other people more than we care about ourselves? Because if we don't do that, we're not going to be able to send our kids to school. We're not going to be able to go watch sports. I really wish I could be watching some baseball. I would love to be watching football in the fall. But we're not going to be able to do any of that unless we take care of ourselves first.
So to that point about people going outside and dining, I'm also, thinking of rallies, political rallies, specifically in Tulsa, where President Trump held a rally not too long ago. Well, health officials are now saying that has potentially contributed partially to the surge. So, I mean, should we be banning all political events or large gatherings?
I don't think we necessarily have to ban all large political events. I think you need to consider what's the best way to host them. Now, would it have been better to host his event in an outdoor arena where people were spacing, where people were wearing masks? Then yes, maybe that could have been done in that way and been safer. Do we need to host things in a small arena with lots of people that are all right next to each other, none of them, or practically none of them, wearing any kind of face coverings? That is completely unacceptable, and we can't have that.
So I want to ask you about your optimism for a vaccine. We've been hearing from Lilly. They're now saying they're going to be releasing phase 1 coronavirus data. We've heard from Moderna. We've heard from Regeneron. Vaccine makers are going to be testifying in front of Congress. How hopeful are you that a vaccine is on the horizon?
I would love to see something on the horizon. Unfortunately, I'm not a virologist or a vaccine maker. I'm not an expert at that. I'm an ER doctor. I treat patients in the hospital, at least every day, every other day. So that's where my expertise is. I would love to see us have a vaccine that's effective. I would love it if every single person in this country would volunteer to get the vaccine so that we could help stop the spread of this disease. But again, this ultimately falls on every individual American to do what is right, not only for themselves, but also for us as a society.
So I want to talk about that point because we heard a lot of, people protesting that they have to wear masks. It seems almost every day we have a video of someone completely irate when they enter a store or an establishment that they are being asked to put a mask on. Starbucks today announcing that they were going to mandate that customers wear a mask in just a couple of days. Do you think that we need a requirement from the federal government or from each individual state to say, hey, everyone needs to wear a mask when they go out in public?
I wish it wouldn't have to come to that. I think that honestly, like, politics, healthcare is best delivered at the local level as well. The situation in local areas probably determines whether or not you need to have masking. And I think that if it were up to local politicians to make those decisions and they were empowered to do so, that would be the best place to do it. In lieu of that, if it needs to happen at the state level, great. And if it gets really bad, if it has to happen federally, so be it. I think the simple fact remains is something as simple as this mask can protect you, it can protect your loved ones. And you know what? It's not that hard to wear. I wear stuff that's far more painful on my face and far more difficult to breathe through for 8 hours a day. And I'm still here living and breathing as I talk to you right now.
So I want to lean on, obviously, your expertise as an emergency room physician. We've been hearing, or we heard when the coronavirus pandemic really first hit, this kind of doomsday scenario, specifically when it came to hospitals running out of beds. And we are now actually hearing how, for example, in Florida, over 50 hospitals there had no more beds in the ICU. Do you think we actually are approaching that doomsday scenario, at least in states like Texas or Arizona, Florida, and others, where we're going to see these hospitals at capacity and unable to take patients on, whether they have coronavirus or have some other illness?
That's a really complicated question to answer. And the reason is because the capacity situation is a little bit fluid. I like to talk about it like, consider a jumbo jet. If you have a jumbo jet, you can have a whole ton of economy seats where people are cramped in, packed in real tight. Or if you need something like ICU beds, think of those more like your, first class seats that lay flat. They take up a lot more room. You don't have as much space for that. But you can reconfigure how it works. So what happens is you have a hospital, and like what happened in Houston recently, maybe about a week or two ago, our hospitals filled up and our ICUs filled up to the point where we had almost no beds or we were almost over capacity for beds. But our hospital leadership across the city changed configurations. Maybe we've cut back on some of the elective surgeries and we created space for patients to get to. So I don't think we're at the point where we're at that doomsday scenario like what we saw in Italy or what we saw a few weeks ago back in New York. I think we're in a better situation than they are, especially in Texas. But I think unless we get a handle on the disease itself, and unless we cut down on the overall case counts, we do risk running out of space.
All right, we'll have to leave that there. Dr. Cedric Dark, Assistant Professor at Baylor College of Medicine. Thanks so much.
Thank you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.